resources in San Juan County. Back in June, we held our first community discussion on substance misuse and overdose. We wanted to call attention to the issue of opioid misuse and overdoses in our community. Since 1999, the rate of drug overdose rates in San Juan County has more than doubled. And according to the New Mexico Community Survey, the percentage of people who currently use painkillers to get high has also seen a large increase. San Juan County Partnership brought together an opioid misuse and overdose prevention group. This group, consisting of experts and local organizations, will endeavor to make San Juan County a safer place in which to live. Today's goal is to offer educational resources as well as give the community a platform to discuss this very important topic. We'll be holding these community discussions on topics quarterly to help address different aspects of substance misuse and overdoses. Since September is National Recovery Month, we want to celebrate with all of those in recovery. We want to know, what we know for many is that being able to access the resources they need is vital to success. So today we want to talk with a group of panelists who have experience navigating the resources here in San Juan County. So who we have with us is Carm from Total Behavioral Health, Jessica from Four Winds Recovery Center, Joel from Presbyterian Centennial Care, and of course, Paula Jackson from Angel Peak Counseling. Thank you guys for being here. Really appreciate having you come out.
Thank you.
Thank you.
Thank you.
So we have a few questions already from the audience, and so we have an off-camera special staff member over there, Amanda, who for some reason we gave a mic. So go ahead and ask those questions.
So how does someone know if they have a drug or alcohol problem, or how do they identify it in someone, a friend or family member?
Whoever wants to take it first.
I'm going to take off running with that one just really quick. When we see all of those different behaviors by someone in our family, it's like this is not their norm, right? So we're always, it's like you can kind of look at that and be like, oh, this is going on, that's happening. Maybe this is a substance and not just maybe a symptom of their mental health or something like that. I forgot the other part of the question.
How would someone know if they have a problem themselves?
That it's just like, I might be out of control.
Mm-hmm. Yeah. Does anybody have anything to add to that? What you've seen maybe in your practice or in your own personal experience?
I guess what I would hear from the people around them, their support system, whether it be family or a partner or whoever they live with, would be that they used to be like this and now they're like this. So, talking to the person in their own home or wherever it would be and say, this just isn't the old you. So maybe we need to get some help. Mm-hmm. And, it could be mental illness, it could be substance abuse, it could be really stressful time in their life. And, that would be when you would probably seek help, which would be, and it's not always just medication or counseling, it's a combo or either or. So, what I've seen people in the past is a family member could bring somebody in and to any type of counseling centers here in San Juan County, and you're going to see a master's level therapist first, and they're going to do the assessment, and then when they do that assessment, they do recommendations. Well, these are the symptoms that you have. Maybe you need to see a medical provider, which would be a psychiatrist. Or maybe you need the case management or CSW piece where maybe you're homeless, or maybe you're need your bills paid, or maybe you haven't had an ID for 5 years. Or so that actual the master's level therapist kind of makes that decision within that mental health assessment. And then like we had talked before, there's a lot of assessments. So then say if you do need to see a med provider or a psychiatric provider, there'll be another assessment with different questions and stuff like that. So I think it's it's just everybody that's in your support system would probably be there to help you or see the change. And the other, unfortunately, way would be law enforcement, different behaviors, or you're homeless. the court system see that, oh, you did this isn't really you, let's get you some help instead of just put you in jail or send you to prison or whatever the crime is.
Yeah, and usually there's like a pattern in their behaviors, you know. For example, if they go off of their meds and then once they go off their medication and then they start committing crimes and then going back to jail and then they get back out and they're okay for a little while, and then they start isolating, getting off their meds. So there's just a pattern in their behavior. When you see it from, in other people. And for yourself, if you think that you have a problem, like what Joel said, the unmanageability, you stop paying your bills, you stop being a responsible person, and you kind of identify those patterns in yourself, like I start drifting away from people, my support system, I start isolating, I stop talking to people, and then I know that I'm in dangerous waters, so yeah.
Very good. Carm, do you have anything to add?
Yeah, sometimes it's hard to admit, like if you're an opiate user or if you're an alcoholic, it's hard to admit to yourself that you have a problem, and like for me, I've been out there for almost 15 years, and finally I got help to go to Total Behavioral Health, and it was hard for me to accept that I was an alcoholic or a drug user, and when I finally got to that point to where, I had to accept myself for who I was and getting that help, it's sometimes that, I had a brother that I try to help, I referred him to Tota, he got the packet, and, it's really up to that person if they want help, and if they withdraw from you and, you're like trying to be there for them, and, he passed away about 3 months ago from us, so, I try to get help for him. And I think family members are like really hard to help. Mm-hmm. And, other people, like now I work under TOTA. I say we're like the mental health assistants. We're the backbone of that facility where we work. And, I use like kind of like examples, for them to stay and not for them to come back out and start using again. So I kind of use different, examples for them, and they think about it. So right now it's against the law to give them counseling. So I reverse the question on what they ask me. I reverse it back to them, and it kind of works, and I've been sober for it'll be 11 years this November.
Good job.
So I feel good for myself, and I tell my relatives where I work, if I can do it, you guys can do it. Mm-hmm. So far, there's like 5 people that are employed. I'm proud of them, and we have one that's been sober for 1 year, and, she's come a long ways. And, it's just so, you have that good feeling, great feeling for helping someone like that, especially when they come back to you and say, thank you. Thank you so much for helping me and being there for me. That makes me feel good, so, yeah.
Yeah, congratulations on 11 years. That's awesome.
Awesome.
Yeah.
I wanted to mention that if, I remember going into my first NA meeting, and they have informational packets there. One of them being, am I an addict?
Right.
You open it up and it asks you a bunch of questions, and I'm sitting there looking at it and I'm like, yep. Hey, I think I might be an addict.
Yeah.
That is an overwhelming piece when people are looking for help. Everything has a packet. Mm-hmm. No matter where you go, there's a packet to fill out.
And that's what I was actually going to ask about, that assessments, because we hear packets and we're like, oh my God, that's so overwhelming, or how much am I going to have to reveal on this packet before anybody talks to me? Or maybe, I might have a literacy problem or something, and reading is not easy for me, or English is not my first language or something, and it's difficult to navigate or whatever, or there's all sorts of different maybe insurance questions we have. So can you guys like go into that assessment piece, because sometimes I think that is a barrier to folks getting some services. So Paula, we'll just
Okay.
go back to you since I
Well,
interrupted you.
That's okay. I think on the assessment packet, I do, as a community support worker, if somebody would come into our facility and they had all those limits, I would go and help them with it. The hardest part of the packet, I think, is answering the questions and being truthful and saying, whoa, this is me. So that's hard to admit. Mostly when you're looking for help, you're trying to admit on that packet all these things that your family's been telling you, the court, your partner. And so I don't, I think that probably, maybe we need to change the way we hand out packets of saying, hey, do the best you can. We'll get through this. We need the packet to put in the computer to bill the insurance, but I think, I never really thought about the packet being the stopping place, but it is. And there's in most places, like you guys would help somebody do a packet if they were at Total, right?
Yes.
Yeah. In any facility that you would go to, there should be somebody there to help you fill out that packet, and somebody not judging you or, making sure you have all the right stuff, or you're, why are you here? My mom sent me. Great, that's fine. So, there should always be somebody to help with that.
It's good.
I just kind of wanted to go into stigma with that.
Yes, please do.
With a lot of people with whichever mental health, drug, whatever problem, the family wants to say, oh, you need to go get help. You go down to the clinic or you go to Total by yourself. I don't want to be seen there. So if we could, that's our main thing here in San Juan County, is to stop that stigma. And it's, I have people that say, oh, I don't want to go down. They're going to see me at Total. They're going to think I'm in treatment. They're going to think I'm better than them. And, you don't realize that till you work with people and see that. And with a case manager, a therapist, or whoever, it's that support system of the people that are trying to help you, not really your support system like family, because educating the family or the support system is saying, we need to stop that stigma, because this isn't, getting...
Right.
If you have cancer, everybody's going to go with you. But if you have schizophrenia, you go by yourself. Because, even if I'm not educated on cancer, there's not a stigma. But on schizophrenia, there is, or drug use.
Yeah, and actually, sort of drafting off of that, let's talk about support system education and support system resources, because we also know, Jessica, you mentioned isolation a lot, and that isolation is another thing that stymies progress in any type of recovery. And so when it comes to support systems, what kind of educational opportunities are out there for loved ones of somebody who's struggling?
So I'm going to say, coming from the insurance world, I work for one of the big MCOs here in New Mexico.
Which stands for?
Stands for Managed Managed Care Organization, excuse me.
Great.
Thinking Managed Care, MCO. And so, they offer care coordination, which is kind of a little bit like case management or a community support worker, because they're going to go and meet you where you're at. And it was like they're going to do their own assessments, which is a comprehensive needs assessment, which just basically goes through everything that you're going through. It's like, how are we as an insurance company going to be able to support you through all of that? Because sometimes it's just a twisting, winding road, right? It's just really hard to traverse all of the different agencies, and you're meeting with this person and that person and this person. But it's like, and so I just really feel like care coordination is a really good step. So if you do have Centennial Care, there's a number on the back of your card that is for customer service, and you can call up and request care coordination. We also have our peer support workers who, again, we don't do any assessments or anything like that. The peer supports don't. But, we're talking about your mental health, your substance abuse. You need help filling out that packet to get your SNAP benefits, whatever. We're going to assist with all of that as well. Plus, we're coming from that place of lived experience. That's just saying, like Karen said, if I can do it, you can do it. I've been in your shoes. I've been homeless. I've been an addict. You know, I've struggled with this and, you know, all of these different things. So you're making that bond. So you're able to kind of go in and if we don't have family or natural supports, peer support is an awesome extension that we can kind of start out with till we make our way back in to get that natural support. You know, a lot of times our families are like, done, drop the mic, peace out. I'm like, we're done with you. You've stolen from us, you've wrecked our cars, you wrecked our, you know. So it's just like you don't have that kind of support sometimes. So we need to look outside for that. Whether that's a community support worker, or we have case management, we have peer support, we have care coordination. You know, so it doesn't always have to be clinical. It doesn't always have to be a therapist or, you know, a psychiatrist. It's like we can just have regular Joes walking along the street that say, been there, done that. So let me help you go through that maze.
And I think what the stigma part, what we were talking about with the peer support, when the support system sees somebody do it, then it gives them hope. We have a little saying we always say, if you see no hope, we're going to hold the hope for you. So, you know, when you bring a peer support in with a parent or a partner or whatever and say, hey, I was where they were at and look at where I'm at now. And that helps a lot within that educational piece to stop the stigma of, oh, you can get better. Oh, you know, you can do this. So I think that helps. It helps parents see it. It helps partners. It helps that support system see that you can recover. So.
Yeah, and educating the family is important. I think just support groups like Al-Anon is important. You know, it helps the family show, like it helps them stop the enabling, you know, and maybe kind of not give up on their loved one.
Yeah.
Yeah, and also at the Four Winds Treatment Center, they have family days, so they bring in the family and they talk about addiction and the behaviors that go along with addiction. And after the family days, they're more informed about their loved one's addiction than when they went in. You know, they're just like, oh wow, I didn't know that's what you were going through. You know, I didn't know that's how you were feeling. I didn't know that what I was doing was hurting you. You know, so it gets a lot out during those family days.
And speaking of family support, and also in that we include loved ones and close friends. So you mentioned Al-Anon, which is for loved ones of those who are struggling with addiction. I'm also aware of NAMI, National Alliance of Mental Illness, for folks that are struggling with mental health difficulties. Are there other things that maybe I'm not mentioning or unaware of, and which I'm sure is always the case? There's always things I'm not aware of, but those two stick out to me and also they're ubiquitous and free. So it's a great resource in that sense.
I think Total has family day, don't they, on the weekend? It depends on.
Well, their family comes whenever they want, but right now it's kind of hard for them because the social distancing.
Right.
And sometimes they come back in all sad, saying I wanted to hug them. That was my first time seeing them again, and I was like, at least I tell them, at least your family's seen you clean and sober. You got to talk to them, but this is for you. You're doing it for you. So they have family come whenever they want. They got friends, but yeah,
I deal with a lot of people with severe mental illness, and you usually get a parent that says that was their fault.
Yep.
So you need, that's the education piece, is trying to teach them, this is not your fault. It's a chemical imbalance. And to see mostly, and I'm going to say mothers, that's the majority, they need that mother group to say, I am a mother of a child with severe schizophrenia. You know, I think they need to talk to other mothers, just like everything else. We're just not there with mental health yet. You know, I talk a lot about AA. It worked. It works. It's from peers. Mental health. We need to follow the same steps as NA, AA, and we're doing that within the last 5 years, 8 years. You know, I think it's really on fire now, and that's the model that we're looking at. Hey, I've been where you're at. Let me educate you why I do that. That's why you have Family Day, and you know, and I think we're headed in the right direction. It's just you have a lot of, you know, as a mother, you're not going to say, well, maybe it's the way I treated the child. He was a drug user, but when you get into that chemical imbalance, well, maybe it was my reason he has a chemical imbalance. What did I do during pregnancy, or you know? And I think that's where the support system needs to go in the psychiatrist appointments or in the doctor's appointments to learn that. So
Well,
that's
like
the
you said
education.
too, so think about it. If your kid has cancer, you're going to go into that appointment with them, right? You're not going to be ashamed, and you're not blaming yourself that something you did caused your child to have cancer or diabetes or you know, or anything like that. It's like it's that whole stigma of, oh, I have a behavioral health disorder, or my kid overdosed. You know, I'm just going to drop them off at the ER, you know, and run away. And not be there. So it's just like letting them know that these are choices that we make on our own, right? I mean, I made my choices. My parents didn't say, hey, grow up and be an addict. You know, hey, grow up and be mentally ill. No, it's like, you know, and I have many siblings, but, you know, my parents just did not understand that. And I feel like coming from the world that I'm in now, you know, for the last 10, 15 years, it's easier to talk to my own children about that because I have grandkids, right? It was just like, and when my grandkids are struggling, I don't always want to be like, oh, they have symptoms of this. But no, I said, let's talk about it.
Because you're educated.
Yeah, it's like, let's talk about that, you know, and sit down, you know, with the kid and with the parents. And I think that we all have that opportunity to have that conversation with clients and their, you know, people that love them, that just say, I'm on y'all's side.
Yeah.
Well, that brings to mind, I worked with the CSW lady for many, many years, and I would hear her on the phone with the mother of a schizophrenic child, and it would be a young man, and after the mother would tell her everything, she would say, that is totally normal for a 21-year-old schizophrenic. And then when the mother would hear normal, what is normal? And she'd say, that's normal for those symptoms. And it kind of gave the mother at ease when just to hear the word normal, whatever that is, you know. And so I always use that, well, that's normal of somebody that uses drugs and has a diagnosis of bipolar. And then it kind of reels in that support system of, oh, you know, so I think that normal.
And I feel that in this area, educating the families is so important just because a majority of the alcoholics are Native American, and the Native American background, like, you don't talk about those things, you know, the negative emotions that you feel, you know, anything negative that happens in your life is kind of swept under the rug. You know, it's taboo to talk about negative things. So, you know, bringing that education to the Native American population and being like, hey, it's okay to talk about these things. You know, we're doing more harm keeping it in than we are getting them out. I know from personal experience, you know, some of the abuse and the trauma that I've been through, and I would want to go to a family member, and they're like, no, we don't talk about those things. You know, so of course I did the only thing that I knew how to do, and that was just stuff it down and cope with it with drugs and alcohol until I was able to break away from that and be like, hey, I need help.
Yeah, it's very good, very good. I don't want to neglect our questions out there. Sorry, we've just been like rolling, which I love it. I love it.
No, that's great, but we do have some questions about, you know, you guys talked about some of the signs might be that they get in trouble or things like that. What if someone's never been in trouble? They see a family member that, you know, seems to be doing okay, but they're seeing some concerning issues. How do they take that first step to call? Who do they even call? You know, there's all these places. There's TOTA, there's PMS, there's Four Winds. How do they know who to call first to start the process?
I think they should just, look online and look up counseling and start from there. Whether it be Desert View, PMS, Angel Peak, or if the insurance companies also, even if you have personal insurance, call your insurance company. Where do I go? This is what I'm seeing. There's been quite a few suicides this month for Recovery Month, and those are things you don't see. And even if you feel like they're isolating, or just call a counseling center, wherever it may be, and that counseling center or your insurance will probably set you the right way to get a hold of somebody.
Well, and we also have the New Mexico Crisis and Access line, and they also have
Good
that peer-to-peer warm line. So it's like when you're questioning those kind of behaviors, it's like call the crisis line and talk with a licensed professional that's going to try to walk you through the behaviors and kind of help you traverse that maze again, right? If you just want to talk about your spouse or your sibling or your child or whatever, it's like you're always welcome to call the peer-to-peer warm line. And like I say, those are for peer support workers. We're certified by the state of New Mexico. And like I said, we have that lived experience. So I feel like those are both really good lifelines for a lot of our folks out there who are really kind of struggling with, what do I do? Or go to your primary care physician. It's like, do you have a primary care doctor that we can go and talk about that? Primary cares now, it's like they prescribe medication for behavioral health disorders. They can also kind of steer you into that direction, whether it's within their own agency, that says, oh, we have psych on board here. We have behavioral health professionals, so we're going to hook you up with them to have that conversation.
And what's the number for that crisis line?
I wish that I had my little magnet with me right this moment, because I would hold it up and read it to you.
Yeah.
We can put it in the chat.
Let's put it in the chat.
Yeah.
And I know that there's also a national suicide prevention
Yes.
hotline. So maybe we'll put that in the chat. But speaking of crisis, though, and the existence of emergency rooms, at what point would we want to just, get in the car? We're going to go to the emergency room, and let's talk about the stigma of that might exist and how we don't have to have a stigma there. So when are we at a level, hey, crisis level, we can't even have the conversation. We got to get you somewhere now.
There, we do have local CIT teams, crisis intervention through the police department, mostly the sheriff's department. If you're a parent and, not most people will get in the car with you and let them take them to the emergency room. And even if they're not breaking the law, you could still call as an emergency of, they're isolated in their room, I can't get them out. They haven't eaten for 3 days. The crisis intervention team, they're not social workers, they are police officers, but they do have resources to get a hold of these counseling centers. Farmington has a CIT team. And, if you're at that desperate measure, call and say, I have an emergency at home.
Yeah.
And, they'll get you hooked up.
Very good.
Really, if you feel like they're in danger of harming themselves or others, that is a perfect time to call. That is a perfect time that if you can get them in that vehicle, to get them down to the ER to talk with a professional.
They have a social worker at the ER that they
Right.
talk to.
Yeah. Right. Yeah, I thought that was important to mention. And of course, the CIT team is not a punitive, even though they happen to be law enforcement.
But they're trained for mental health.
They're trained for,
so,
yeah.
They don't come in as police officers. They come in with resources.
Right.
Right. They want to de-escalate it. They want to keep you out of jail just as much as you want to stay out of jail. They want to keep you out of the hospital just as much as you can. So it's just like they're there for it's like they're a behavioral health. They're trained in
They're
that.
a piece of the puzzle.
Yeah. Yeah.
Yeah. Very good.
You're being kind of quiet, Carm.
Yeah,
You guys
Carm.
are all talking. I'm trying to listen. That's some good information that I can, go back and say, hey, there's all these that, we can go by. So, it's good.
That's good. Very good.
You guys talked about accessing your insurance provider. What if someone's to the point where they don't even know where to start with Medicaid or getting insurance? Is there a resource in the community that can help them navigate even getting to that point where they have a plan?
We have some behind the scenes whispering. Go ahead and just say it out loud.
There will be in a couple of months.
There will be in a couple months. And what is the thing that's coming in a couple months?
There'll be a behavioral health resource center type program where somebody can go to begin with.
Oh, see, that's awesome. We got to put that at the forefront. Great. So we just have a 2-month countdown. So I'm gonna create a special Advent calendar for the Behavioral Health Center. We can get a chocolate a day as we go on. Good. And any other comments on that important question?
I was just going to kind of say too, it's like when you have that comprehensive community support services, they have those community support workers, right? That, let's start there. Paula can help you fill out your application for Medicaid, right? It's like she can get that ball rolling. Make those phone calls for you and say, are they covered? Do they maybe really have it? Because, most of us are covered these days, right? The majority of people are either have private insurance or they have a Medicaid. One of our MCOs.
Well, when COVID wasn't here, even going to the local ISD office, the food stamp office, they have people there that are do community service that when you walk in, they say, how can we help you? If you don't know how to read or do the computer, they help you through, they walk you through the application.
And what does ISD stand for?
Income Support Division.
There you go. Cool. Great. So it's like this profession is so laden with all sorts of acronyms.
I didn't know what it stood for, honestly.
It's just important to.
I say food stamp.
Yeah, Carm, did you want to add something?
Human resources.
Human HR,
Yeah.
right, medical coordination.
Yeah, well, for now, at where I work at, it's called Paul's Place. It's under Tota, and they have like some of the relatives stay there. It's like a little dorm. They finally got computers in there, and some of them applied for work. Now, like I said, there's at least 5 of them working, and they're beginning to do housing. And we try to encourage them to learn how to use the computer. And we have, some of my coworkers that are computer literates. They help them, and so they're right there. They have help. The kid, and there's a Navajo or a Native traditional coordinator. She used to go out to Catholic charities and just drive around looking for people and say, hey, come over here, and when they get there, she gives them a packet and she tells them, if you need help, let me know, I'll help you. And when they can't read, she sits right beside them, and there's a lot of help that they can get at Tota. And that's where I got my help. I've been there for almost 7 years, and I used to live with my sister, and just here and there, it's getting hard for me. And like I said, I've been out for like 15 years out in the streets, and she helped me. She used to see me at Catholic charities, and she kept telling me, go over there. There's a free shower, clean up. Maybe afterwards you can think about, filling out a packet. If you really think that you need help, So I went there, and almost going for 8 years. The main boss, Christine, said, hey, you know what? There's a job opening. Maybe you can, fill out an application and go from there. So it took me like 3 months to get in, and I did, finally get in, and I was proud of myself on how far I've come. Now, like I said, I'll be sober 11 years in November, and I got married, and I had my CSW, she helped me with my short-term goals, and she had seen me accomplish them. And, I was happy that she had seen me do all those things, and she had passed away. So she was my CSW, and then afterwards I became a coworker to her. And even then, she kept pushing me, encouraged me, keep going, you're doing good, keep going. So now, like I said, I'm married and we have a little, almost 2-year-old, and we have two older girls. So, like, it's just so amazing, like, I feel proud of myself, I feel good, and that's what I tell my relatives, it's like, if, you can do that, and now they, come up to me and tell me, hey, you know what, if you can do it, I can do it, You've been, you've come so far. So, like, that's where all the resources I got is from TOTA. I got help with getting food stamps, Medicaid, they help me, they help me out a lot. So here I am now.
Yeah.
I love that they call them
Relatives.
Yeah, like I love that.
Yeah,
That's
yeah.
I like what Carm said about the short-term goals. There's some programs here that will sit down with you and be like, okay, what do you need? Like, what is the most important thing that you need? Do you need your ID? I know that the Masada House, they have a treatment plan, and it's like, okay, what documents do you need? They have the birth certificate, the social security card, the ID, and then you kind of just circle which ones you need, and then they're like, okay, so how can we get that? What do we need to do to get those things? That's the immediate goals, and then they have the short-term goals and then the long-term goals. So I think that's important for every treatment.
Yeah.
And mostly if you've lost all those things.
Yes.
And the family is like, oh, we've got them, I hear a lot of the guys on the street, I have already had my 10 social security cards, and I'm like, okay, we're going to write a letter. So, that's the thing is like, where do you go to get those little things that I've probably had my ID for 8 years already, they're like, oh, he's lost his ID again. And you've got to have those things on board to go to the next step. And so I think that's really important that you say that little tiny short-term goal are, oh, we want him to get his own apartment. Let's get an ID first. Let's get an income. So
Baby steps.
way baby steps. Yeah. And I know the support systems, when they want their person to get help, they just want to, oh, we're just going to go and this place has housing. You're just going to go in there and get housing. It's a little bit longer than that, but you just, honestly in mental health, like we said, the education, but it's that people that you're working with supports the whole unit, the family, the mother, the partner, whoever, and we need.
Good. Well, I think we have roughly maybe 10 minutes left. If there are are there questions out there?
So someone asked, you guys talked about the stigma around mental health and substance use. Is there something we as community members can do to help reduce that stigma, both around substance use disorders and Medicaid-assisted treatment?
Educate and spread awareness, for sure.
And talk about it.
Yes, and because a lot of people, it's something. I know one person came up to me and they were embarrassed to tell me that they were struggling with depression. It's just something that we need to bring more light to, more awareness. It's okay to ask for help. You're not the only one.
And it is. It's about educating the public that I'm another person on this planet just like you are, right? I'm still walking around, struggling here. Sometimes not, sometimes, So it's just like understanding that person you see walking down the street today and you're like, oh, they're inebriated, instead of jumping to the judgment, right? Because we always want to jump right in and be judging people. And it's just like, excuse me, what if he was at the dentist and he had a tooth pulled and he's on some pretty heavy medication? So it's just like kind of putting yourself in check and just saying, I'm not here to judge anybody. We see people, on the street all the time.
Well, and that's the
we
thing.
all do, right?
Stigma starts with the person.
Yeah, Yeah, it's like
You know,
you drive
people
down
need to
any
stop.
street, and it's just like, and you will see people, and especially in the downtown area, you know, we'll see groups, you know, congregate, and we're all like, oh no, they're gonna jump us, they're gonna steal our car, and it's just like, maybe they're just maybe they're having a little prayer group right there over at the income support. I don't know what they're doing, but instead of jumping to that immediate conclusion that it's up to no good, my bad.
Yeah.
I think it's just talking about it, having these meetings, you know, working with safe communities, getting it out there that there's recovery.
Very good. Is there anything else out there before we wrap it up?
I think that looks like we've answered most of the questions. Just do you guys have any final thoughts on if someone's struggling to get resources, what do you recommend they do?
Just get help, you know, ask for help, put it out there. Like, I don't know what I'm doing. You know, whenever I came into recovery, I didn't know what I was doing. I didn't have an ID. I didn't know how to pay taxes. You know, I was just like, how do I do these things? You know, like, how do I become a productive member of society? You know, where do I go to get the help? Paula was there when I got my first job in recovery, and she was so excited, you know, and it was, where was it? Payless, huh? And she drove me to the interview, and she helped me. It was great, you know, and admitting that I don't know what I'm doing, pretty much. You know,
Admitting you need a support system.
Yes, and that you need help.
And everybody has a support system, you know.
Very good.
There are a lot of people out there that are more willing to help you than you think.
Yes.
Yeah, I think that is a good note to end on. And of course, you four are some of those people. San Juan Safe Communities, we are some of those people. San Juan County Partnership exists for that purpose. So follow the San Juan County Partnership Facebook page. We'll have more forums. There is information coming through that channel all the time. Same with the San Juan Safe Communities Facebook page. There's information coming through that channel. Again, Carm from Tota Behavioral Health, thank you for being here. Jessica from Four Winds Recovery Center, thank you for being here. Joel from Presbyterian Centennial, thank you for being here. And Paula Jackson, we were just joking about how you can't just say Paula, it's Paula Jackson. From Angel Peak Counseling, thank you so much for being here. Let's stop the stigma, get ourselves educated, and look for help where we need it. Thanks for joining us.